Almost everyone knows that testosterone is a hormone that men have, but no one is really talking about which are the normal levels of testosterone, what are the functions. Do we need testosterone at all? Are we having less testosterone than we used to, than maybe what my father had when I was the same age, or maybe my grandfather? Is it something that we really need to be talking about? Well, yeah, and it's a real issue. It's a real problem. Men right now and women all over the world, we are getting very low levels of testosterone. This is something that we really need to be addressing. In this video, I want to be talking about which are the things just with lifestyle. I'm not going to be talking about supplements at all. Just with lifestyle. Things that we can be doing right now in order to start managing our testosterone levels. So we need to remember that testosterone, it's a hormone that it's produced in our testicles, and in women, it's produced by the ovaries and it's also produced by the adrenals. So testosterone also, it's very important and very necessary in women, but in men, mostly it is necessary to do all the differentiation in sexuality, all the characteristics in masculine sexuality. It's also responsible for fertility. It's also responsible for all the appearance of arm hair, of hair in the legs, of all the appearance of the beard, of the mustache. All those characteristics are common by the production of testosterone, but also all the development of the muscles, all the production of sperm, all the maturity in the prostate, all the maturity in all the reproductive system in men, but also in women. All the generation of muscle, it's not only dependent in men, in women too. Although there is a big difference in the way that men and women are going to get the differentiation in the muscle or the growth of the muscle. And it's also present in the change that we get in the voice.
Divine. Hey, my voice just changed.
It's also present in the way that we grow during adolescence. But it's also very related with a lot of mental symptoms. Things like people wanting to be in different competitions or being in competition with other things. That's also an ability that people might get for making business, for being better at business, for being better at work, maybe also for libido. Some people think that testosterone, it's only related to being more aggressive, but it's not only the fact of being more aggressive. It's also the fact of getting all the care for the herd or all the care for the pack. When you go and see wolves, when you go and see lions, when you go and see different animals, the one that it's the stronger, it's the one that has more testosterone. That's the leader of the pack. And it's the leader because also testosterone not only gives him the capacity of being in the power of defending the pack, but it's also in the power of that hormone gives him all that mental capacity of having this sort of protection. That's why we feel in a way with our families that we are like in that kind of protection with the pack. And it's something that it's absolutely biological. Also things like looking for a couple, obviously libido, it's very related with the levels of testosterone. What are the normal levels of testosterone that you should be talking to your physician in order to be achieving good levels? So go and get your blood test. For men, in between 800 to 1,000 of total testosterone, and maybe levels in between 15 to 20 about free testosterone, and that's what most people are looking for. Most of these clinics that they are giving therapies or they are aiming for good levels of testosterone, this is what people are looking for. But again, please go and discuss it with your physician. But what is the problem? The problem is we know for sure, and we know now, only in the past 20 years, the decrease in the production of testosterone compared with men of the same age from adolescence to adulthood, the decrease in testosterone has been dramatical. And it's something that it's very related with lifestyle, and it's very related with how we're living today and with the consequences, especially the consequences, the metabolic consequences that we're getting right now. When we are increasing inflammation, when we are increasing insulin levels, when we are increasing glucose, when we are decreasing the amount of muscle that we have, the amount of testosterone, but especially the amount of free testosterone that we get in blood, it's going to be very low. What this starts occurring is that people start getting symptoms, and it's something that it becomes a loop. Why does it become a loop? If I have low muscle, and if I have a lot of amount of fat, I'm going to get low levels of testosterone, especially low levels of free testosterone. If I have low levels of free testosterone, then I can go to the gym, or I can maybe work a little bit, and I'm not going to get the same amount of muscle. If I'm not getting the same amount of muscle and I start losing muscle, then I'm going to have less free testosterone, less total testosterone, and it's going to be an eternal loop that it's going to be increasing inflammation and increasing all the things that are going to be related with low levels of testosterone. So which could be the symptoms of low levels of testosterone? 1, increasing weight, especially increasing fat. 2, having little amount of muscle, and you could see maybe this kind of infantile appearance of someone that is already an adult or maybe an adolescent. Having low libido. Being maybe sweating all the time. This could be due because when we have low levels of testosterone, especially in men, we can start converting into high levels of estrogen. And high levels of estrogen might start giving men some of the differentiation into appearance of women characteristics. People might start feeling fatigued, a decrease in the composition of the amount of minerals in our bone, leading to osteopenia or osteoporosis. People having a shorter penis or smaller testicles. And I want to show you this article that shows that obesity is strongly associated with small penis and also with small testicles. And also it's related with low levels of blood because the production of red blood cells is in men dependent from the production of testosterone. That's why men usually have more red blood cells than women do. So what can we start doing? If we see that now, the way we are living, 88% of the population in the US have a sort or maybe a kind of a metabolic problem. When we go and see that right now 72% of the population are overweighted and or obese. When we're seeing that for 2030, we expect that 50%, 1 out of 2, is going to be obese. Not overweighted and obese, no, obese. What are we going to do? Because things in our lifestyle, things in our diet for sure are making us sick in a bunch of ways, but they are making that we are starting to see our testosterone levels decline abruptly. And it's making that a lot of men are infertile. A lot of men have childish characteristics throughout their whole life because they never get enough levels of testosterone. So when they were adolescents, when they started puberty, they won't get the amount of testosterone that they needed for having all the development. So what are we going to do? We're going to start having changes in our diet that are going to be beneficial for this. What do we need to do? We need to increase the amount of protein that we're getting. We need to get at least 1.5 grams of protein per kilogram per day, or 1 gram per pound of, if you're overweighted, of the weight that you should have. And also remember that if you want to increase muscle, you need to be taking leucine, that it's present in the proteins. Leucine, because leucine is the first amino acid in which muscle protein synthesis is dependent for. You need to be taking at least 2.5 grams of leucine every single day if you want to have a good amount of muscle protein synthesis. Also, we can start taking foods that are very high in zinc, such as Brazil nuts. And also we can start taking foods that are very high in good amounts of healthy fats. Healthy fats are part of the things that are going to be beneficial for the production of testosterone. But also when we have good cholesterol levels, remember that testosterone is made from cholesterol. So check your cholesterol and see if you have the right amount of cholesterol levels in order to have a good production of testosterone. You need to start taking a diet that is very high in fiber. When you get a diet that is very high in fiber, you're helping glucose spikes and you're helping also insulin spikes. And when you're eating, what I just told you before, a good amount of protein, a good amount of fat, you're going to be satiated for a longer period of time. When you're satiated for a longer period of time and you're balancing foods in a better way, then glucose levels and insulin levels are going to be more controlled. Then you can start doing other things that are going to help your body control the amount of glucose that you have elsewhere. So all that production that you started making of fat, that it's in your liver, in your adipose tissue, inside of your muscles, inside of even of your pancreas, you can start consuming all those reservoirs because it was stored as a way in which you were storing that for later usage. The thing is, you never stopped eating, so you're never going to use that. If you allow your body to have longer periods of time in which you don't eat, what people call fasting or intermittent fasting or time-restricted eating. So the thing is, try to eat all your nutrient requirements in a shorter window of time, and try allowing your body maybe to have 16 or 18 hours in which you don't eat, in order so you can increase the output of that usage of energy through that time, and you're not eating anything. When you do that, and also when you start trying to getting also more output by increasing the amount of physical activity that you do in a day, then you're allowing your body to have more usage of that glucose that you have stored, and also of that fat that you have stored. And then when you start losing fat, then your levels of free testosterone are going to start increasing. So again, bring the right amount of protein to your diet, bring the good amount of fats, and make it with a ton of vegetables in order to get good amounts of fiber. Try to make that in 2 or 3 meals in a shorter window of time, and let more time in which you're not eating, in order to let your insulin be resting so you can be utilizing all that energy that you have stored in your body. For people that already have something with metabolic syndrome, it's better when they try to train while the period of fasting. This is something that it's not better for everyone. It's better for people when they have a sort of metabolic problem. We need to remember that we need to focus on training, lifting weights in order to increase the amount of muscle mass. People start losing muscle mass like crazy, especially after 40. If they do nothing, and if they have done nothing on the previous years. If you have done nothing on the previous years, then you're going to get into a lot of trouble, and maybe getting the right amount of muscle, it's going to be more difficult. It doesn't mean that, oh no, I didn't do nothing, now I'm doing nothing after. No, it means you haven't done nothing. So probably you need to start doing something right now, or after 50, it's going to be even worse. After 60, it's going to be even worse if you even get to 60. So we need to start focusing on physical training right now. We need to be doing cardio. We need to be doing exercises for making more mobility of our joints. And we also need to be lifting weights. By lifting weights, we are reversing what caused this thing at the very beginning. So we are increasing muscle. Increasing muscle increases the amount of energy that you consume just by being at rest. Basal metabolic rest is going to increase. So you're going to decrease in weight probably, or at least you're going to get better your body composition because you're getting more muscle and less fat. When that happens, you are going to increase the levels of free testosterone going in your body. You're going to increase your levels of total testosterone in your body, and then it's going to become the other loop, because if you have more testosterone, you can build more muscle. If you have more muscle, less fat, and less fat, more free testosterone, and it goes all the way again into a good loop instead of being in a bad loop. So this is what we should be focusing on. Also remember to focus on stress management. When we have high levels of cortisol, cortisol will convert into a way that it's not good at all. It's called cortisone, which is inactive. And sometimes we get stuck into a lot of cortisone. Getting a lot of cortisone makes the body not to be able to handle stress properly. If we don't get that, we're not going to recover properly, and you can go and train. And training is going to feel like it's so much to your body. Oh my God, after I train, I feel horrible, and I'm not getting all the muscle that I need, and I'm just feeling absolutely horrible. So it's going to be detrimental, and it's going to be the other way for you to increase muscle mass. So please gather different techniques, what works best for you in order to manage stress. Also remember that sleep is absolutely necessary. You can go and train, you can go lift weights, but that's the stimulus. But where is your muscle going to actually grow? While you're sleeping. If you don't sleep well, your muscles are never going to grow. These are the things that you should be focusing on in a 360 way, because health is something that we construct in a 360 way. I told you that I wasn't going to go deep into supplements. I'm just going to mention some things. There are things like Tribulus terrestris that have been used for the increase of testosterone. Also, Phytodia agrestis, or also taking zinc as a supplement, have been used for a lot of people. And what happens if I take Phytodia agrestis and I don't do any of the other changes? Nothing is going to happen. What happens if I take a ton of zinc every single day, but I'm not losing fat, I'm not increasing the amount of muscle? Probably nothing is going to happen. Again, this is something that needs to be transversal. It needs to be very integral but transversal when we bring a lot of tools into our lifestyle in order to do something about this, which is a big deal. It's a big problem. So again, guys, having normal levels of testosterone, it's something that it's absolutely necessary, and we should really be talking about it. We should be measuring our testosterone regularly. We should be measuring not only free testosterone, total testosterone, but also the protein that binds and transports testosterone, that's called sexual hormone binding globulin. We should be measuring other things, but please, again, talk about this with your physician. But really, if you have low levels, this is something that we need to be talking about it, address it, and remember that that's the only purpose of this channel. So before you leave, if you want to support us, it's very easy, just sharing the video with your contacts. Also remember to click the like button, hit the bell, and subscribe to the channel if you haven't done so. Also, in that way, you're going to be the first one always to be notified when we make new videos. Thank you guys, and I'll see you next time.